Hey everyone, Dr. Clint Steele here with Leading Edge Chiropractic. Hope you're having a fantastic day. I just wanted to kind of go over and reemphasize some of the stuff that we're doing on Facebook Live. In case you're not catching us, we're on Facebook Live every Tuesday at noon, uh, and that's live. And then if you can't make it at noon, you can obviously go to our Facebook page and watch. We try to keep it around 10, 15 minutes or so. And right now we're going over chiropractic myths. Fallacies about chiropractic, things that people think about chiropractic that aren't actually true. And the latest one that we're doing, and please share this, guys, with others, because there's a lot of people out there that think they don't want to go to a chiropractor because they don't want to have their neck snap, pop, cracked. When I go to networking events, I often ask, when you think of chiropractic, how many of you think snapping, popping, cracking, and for the most part, probably 80, 90% of the people raise their hands. And so I want to share with you, as if you're a practice member, obviously you know what we use. We use an integrator. It's called, the technique is called torque release technique. We don't pop, twist, or crack. If we do, it's very rare, but almost never will we do that anymore. I've been a chiropractor for 23 years, and I used to adjust by hand all the time. It's called diversified adjustments. And um, again, for the most part, I saw neck and low back pain, and I got tired. I got burnt out. Retired, was never going to practice again. And then my buddy was out in Colorado practicing this new technique that they're teaching in schools called torque release technique that focuses entirely on the nervous system. And he was getting people better with things like Crohn's disease and depression and anxiety and asthma and just unbelievable things. And I thought, man, I got to learn this. And so I did. And I got back in practice, got trained in this technique and got back in practice. But the one thing that we do when we go out and we talk to people, and this is what I want to share with you, and hopefully you'll share this with other people, because our goal is to help as many people as we can get healthy naturally and stay healthy naturally without drugs, without surgery, without having to rely on something from the outside, because the best doctor, the greatest doctor is the doctor inside you. And that's ultimately what's going to heal you. Everything else is just kind of covering up symptoms. Medications just covering up symptoms. Um, well, I take that back. Not everything else from the outside is covering up symptoms, because a lot of times, you need nutrition, obviously, you need the proper nutrition to be able to heal as well. But bottom line is you need that base of your brain being able to communicate with your body. So anyway, what we use is this. It's called an integrator. The reason I use this, number one, it focuses, like I said, entirely on the nervous system. Number two, it's easier on my body. Some days I'll see 150, 200. I think the other day I saw almost 225 people one day. So it's easier on my body, number two. And number three, it allows me to treat a whole host of conditions that I couldn't treat when I was adjusting my hand. Things like disc bulges, things like osteoporosis. If people have had fusions in their spine, things like that, that I couldn't adjust, I couldn't treat when I was adjusting my hand, but I can treat and use this technique. So that allows that. And then number four, it's much better for you, in my opinion. Again, my opinion is that it's much better for you, not only because we're working on the nervous system, but this treatment here is so quick. See, the idea behind a chiropractic adjustment is force equals mass times acceleration. And so that's a mathematical equation most of you know. Force equals mass times acceleration. So when I'm adjusting by hand, the mass is much greater, the acceleration is a lot less. It allows you an opportunity or the time to tense up. So the adjustment's not going to be as effective as it should be or as it could be. With this technique here, the adjustment, there's not much mass, but the acceleration is so much greater than I can do myself with my hands that we still have the same amount of force, but your body doesn't have a chance to tense up and to counteract that adjustment. So I've gone way over on this. I hope you guys are having a fantastic day. I hope you continue to have a fantastic day. Please share this with others, guys. There's a lot of people out there that don't want to see chiropractors because they don't want to get snapped, popped, cracked. If you're sharing this with other people, make sure you understand and tell them that, listen, they're not going to snap your back. They're not going to crack your back. They're not going to twist and torque your neck. It's a very gentle, effective technique that focuses on the nervous system. So peace out. Hope you guys have a great day, and I'll talk to you soon. It's Dr. Clint Steele, Leading Edge Chiropractic.